million women in the United States have a hysterectomy, but you should know the facts before you go under the knife. And here to talk about all the facts about what's up down there is our resident gynecologist and author of The Essential Guide to Hysterectomy, Dr. Streicher. Hey, Dr. Streicher. Hey. Well, the day is here. Let's talk about hysterectomy.
Lots to talk about.
What is a hysterectomy?
A hysterectomy is very simply the surgical removal of the uterus. The big confusion is a lot of women think that a lot of other stuff comes with it. It does not include ovaries. Sometimes you can add that, but it is certainly not automatic. And it doesn't always include the cervix either.
Now, there are different types of hysterectomies. As you said, you can take everything, you can take some of it, you can... Let's talk about some of that.
Well, basically there's three types of hysterectomies. Total hysterectomy is the uterus and cervix, meaning it's the entire uterus and cervix. Does not include the ovaries. Subtotal hysterectomy is you take away the upper part of the uterus, which is the part that bleeds and generally causes all the trouble, but you leave the cervix. Radical hysterectomy, that's a cancer surgery, involves lymph nodes, a lot of surrounding structures.
And there are many reasons to have hysterectomies too.
You know, the bottom line is the majority of women that have a hysterectomy is because they just can't take it anymore. The pain, the bleeding, they've tried everything else, done. Take it out. 40% of the hysterectomies in this country are done for uterine fibroids. In African American women who have more fibroids and they're larger and more symptomatic, that's about 70%. But then there are a lot of other reasons as well. Pain, particularly endometriosis, uterine prolapse, the uterus dropping down. Sometimes if someone has ovarian growths. Cancer only accounts for 10%. I think a lot of people think, you know, hysterectomy, cancer. 10% is for cancer, 5% is for precancer, and we're actually starting to see more and more hysterectomies that are done for prevention of cancer, for women who we know to be at increased risk for either uterine or ovarian cancer, and we take it out for that reason.
Let's talk a little bit about the traditional hysterectomy. We have graphics for that as well. Let's see what's going on. Let's see what's up down there.
Yeah, I like that. Most women in this country who have a hysterectomy have removal of their uterus through an incision. This is a bikini incision. It's a lower incision. And you can remove through that incision whatever you want. You can remove the entire uterus, including the cervix. If you choose to remove the ovaries, you can. And then, of course, at the end of the day, you end up with a little bikini incision. Most women are in the hospital for 2-3 days. It takes about 4 to 6 weeks, depending on what was done, until they're back on their feet, back to their normal activities. And you're looking at about a 6 to 8 week recovery. Totally. But it doesn't always have to be done that way. Some hysterectomies are done vaginally, where the entire thing is removed through the vagina. And we're starting to see more laparoscopic hysterectomies, where the surgery is done using instruments through very teeny incisions. And we're going to talk a little bit more about that later.
In the second segment.
Exactly.
Before we go on, I should tell folks that I had a hysterectomy. I did. I had
the traditional.
I had a subtotal where my ovaries are still intact. My cervix is healthy, so that was able to stay intact. Just the uterus was gone. And in my case, I had terrible fibroids. Had them removed once. They grew back. I had awful scar tissue from my first surgery. Lots of pain, lots of bleeding. My life was horrible. I was anemic all the time. Changed my life.
You know, I think a lot of people associate hysterectomy with a negative thing, and in so many cases it's an empowering thing. It's saying, I am not going to be a slave to my uterus, which has not been my friend.
And for me it was a good thing, because I didn't think I was going to have children. I didn't have a man in my life at the time to have children, and I said I can always adopt, and it changed my life. I'm healthier, I'm better, and it worked for me. And like I said, I was able to save. I didn't go into automatic menopause, because I still had my ovaries.
That's the key, because a lot of people think hysterectomy, menopause. No. Hysterectomy means no more bleeding. As long as your ovaries are still there,
I'm still producing
hormonally,
hormones.
Nothing changes.
So I'm still going to go through menopause.
You got it. But
there's a web question for you here. Doctor, is it true that when you have a partial hysterectomy, then you start menopause?
Well,
that's what we're talking about
exactly
right now.
what we're just talking about. No, unless you have removal of the ovaries, you're not going to have any menopausal symptoms at all. And for a woman who's already gone through menopause, and usually we recommend removal of the ovaries, there's going to be no change. If a woman has a hysterectomy that does require removal of the ovaries, then she will go through menopause. But we give estrogen, and it's actually, a lot of people worry about estrogen replacement. When someone has a removal of their ovaries in their 40s, you're doing true estrogen replacement. We're not talking about estrogen extension like we see
Gotcha.
after menopause.
Gotcha.
So for a lot of women, we can really ease those menopausal symptoms
good.
if they do need to have removal of their ovaries.
Let's take another web question. Jazzy Jan, do you need to continue with Pap tests after hysterectomy?
That's such a great question because it has to do with the cervix, and a lot of women think if you've done with your hysterectomy, then your cervix is gone. The Pap smear is just to check for cervical cancer. So if your cervix is still there, yes. If your cervix has been removed, you still need to go to the doctor. You're not off the hook yet because someone needs to look in the back of the vagina, make sure there's no changes there, check your ovaries. So you got to continue to visit your gynecologist.
I'll tell you what my doctor said. She said, I took the plumbing, but I left the playground. That's what she said. She did. We're going to have you back in the second segment. So hysterectomies are the second most common surgery among women in the United States. When we come back, we're heading to the operating room. We're going to see what's going on there with Dr. Streicher. You'll see.
If you've missed In the Loop with iVillage, look what you missed.
Brad Pitt.
Regina King.